Hello students, welcome to another lecture of pharmacology, and in today's lecture we will be discussing about the different routes of drug administration. So drug can be administered in our body through different routes, and this is a diagram depicting the different routes of drug administration which we will be studying in our coming slides. So the routes can be broadly divided into two categories, one being your local route and the other being your systemic route. Local route can be further subdivided into topical, deeper tissue and arterial supply, and systemic routes can be further subdivided into oral, sublingual, rectal, cutaneous, inhalation, nasal and parenteral. Now there are certain factors which govern the choice of the route through which the drug has to be given to a patient, right? So the factors include your physical and chemical properties of the drug, like whether the drug is a solid, a liquid or a gas, right? The pH of the drug molecule, the stability, the solubility, then the site of desirable action of that particular drug is also very important in choosing the route, right? For example, you need a localized action or you need a more generalized action. So all these factors are to be considered before choosing a route. Then rate and extent of absorption of a particular drug from different routes is to be kept in mind. Then the effect of digestive juice and first pass metabolism on a particular drug molecule should be considered. If it is a routine treatment, then tablet can be considered, but if it is an emergency condition, then the drugs are mainly given through an injection, right? Then accuracy of dosage required is also very important, and condition of the patient is a very important factor, because if a person is unconscious or if a person is vomiting, then you cannot give that person a tablet or a capsule. Then in that case you have to give him injections only. Now the first route is your local route. So these routes can only be used for localized lesions at accessible sites and for drugs whose systemic absorption from these sites is minimal or is absent, right? So high concentration are attained at the desired site without exposing the rest of the body. Systemic side effects or toxicity are consequently absent or they are minimum, right? For drugs that are absorbed from the site, the same can serve as systemic route of administration, right? Now the first example in your local route is your topical. Now this refers to the external application of drug to the surface for a very small area, or it is required for a localized action. It is often more convenient, right? Drugs can be efficaciously delivered to the localized area on the skin or on your eye or on the nasal mucosa, anywhere where it is required, right, without affecting any other part of the body. Now the second type of local route is your deeper tissues. Now certain deep areas, they can be approached by using a syringe and needle, but the drug should be in such a form that the systemic absorption is slow, right? Now the third local route is your arterial supply. This is mainly the supplying of your drug in the arteries. Now comes your systemic routes. Now the drug which are administered through systemic route, they are basically intended to be absorbed in the bloodstream, and they are to be distributed all over the body, including the site of action, through the blood circulation. The different forms of systemic routes are your oral, sublingual, rectal, cutaneous, inhalation, nasal and parenteral. Now talking about oral ingestion is the oldest and it is the most common mode of drug administration. It basically includes taking your capsules, tablets, your liquid dosage form like your syrups, emulsion, mixtures, right? So it is the safest and is the most convenient form of, drug administration. It does not need any assistance. It is non-invasive and it is painless, right? The medication need not be sterile and is very cheap also. But there are certain limitations of oral route of drug administration, and that mainly includes that the action of drug is slower. Then there are certain unpalatable drugs which are very difficult to administer. That is why, coating of tablets is done these days. Then many oral formulations, they cause, nausea and vomiting. So in that case, if a particular drug is causing nausea and vomiting after, taking it, then it is very difficult to administer those drugs, right? Then it cannot be given in those patients who are unconscious or who are vomiting or who are uncooperative, right? Then absorption of drug, it is variable according to the condition of the patient. Then many drugs are present which are, destroyed by the digestive juices, or they are destroyed in the liver. So the chemical moiety is destroyed by the digestive juices and the desirable action is not achieved. Then the second form of systemic route of drug administration is your sublingual or buccal. Now the tablet containing the drug is mainly placed under the tongue or is crushed in the mouth, and it is spread over the buccal cavity. In this particular case, what happens? Only the lipid soluble and non-irritating drugs can be administered through this method. Absorption is rapid as compared to your oral route, right? And the action is mainly achieved in a few minutes only. Though it is a very inconvenient method because, crushing the tablet and spreading it on the buccal cavity is somewhat inconvenient, but the main advantage of this route is that one person can spit the drug when the desired action is obtained, or if he is feeling any side effects, he can spit that drug at any point of time, right? And one more advantage is that the liver is bypassed, and as I told you in my earlier slide, that in oral route what happens, sometimes the drug is destroyed in the liver only, right? So in this situation, what happens in your sublingual or buccal form of drug administration, the liver is bypassed. Next is your rectal. Now certain irritant and very unpleasant drugs, they can be put into the rectum as suppositories, right? This route can also be used when the patient is having recurrent vomiting or if the person is unconscious. Although it is a very inconvenient and very embarrassing route of drug administration, the absorption is slow and it is very irregular, right? Now in this particular route, what happens, the absorption is very slow and very irregular, right? But the main advantage is that the drug bypasses the liver, so the destruction caused in the liver is not there, right? Then sometimes what happens, due to some irritant drugs, rectal inflammation can occur. Next comes your cutaneous route of drug administration. Now in cutaneous route, what happened, highly lipid soluble drugs are basically applied over the skin for slow and prolonged absorption. The liver is also bypassed, right? And the drug can be incorporated in the form of an ointment and is applied only on a specific area. And the absorption of drug can be enhanced by rubbing the preparation and by using a more oily base, so that it is there on the present on the skin for a longer period of time. So thank you so much, dear students. This was all in today's lecture. In our next lecture, we will study about the remaining routes of drug administration, right? So if you have any queries, any doubt in today's lecture, please feel free to reach out to me. Thank you.